Psychological disorders, Part 4. Psychological disorders are of many types and categories. Presently, there are two major systems to classify psychological disorders. They are Diagnostic and Statistical Manual for Mental Disorders, which is DSM, and International Classification of Diseases and Related Health Problems, which is ICD. First, Diagnostic and Statistical Manual for Mental Disorders (DSM) is classification of officially recognized psychiatric disorders published by American Psychiatric Association (APA). It is mainly used to ensure uniformity of diagnosis by mental health professionals. Its first version was published in the year 1952, DSM-1, and subsequently revised periodically. The present version of it is DSM-5 was introduced in 2013. It contains 22 broad categories of mental disorders with many subcategories. Second, International Classification of Diseases and Related Health Problems (ICD) is created by the World Health Organization WHO for documenting all types of diagnosis, diseases, signs and symptoms, and social circumstances. It contains a section on psychological disorders. The latest 11th version of ICD was presented in 2019. According to the ICD-11, there are 19 broad categories of mental disorders, most of which overlap with DSM-5. It is not possible to study all these categories of disorders in just one chapter, so we will limit ourselves to only few common disorders. Major psychological disorders. Anxiety disorders. One day Hema was driving back home from her office. Suddenly she felt her heartbeats were increasing. She felt breathless and was perspiring profusely. Perspiring profusely. She felt so scared that she stopped the car and got out of it immediately. This continued for many days, and the frequency of such experiences kept on increasing. Due to this, she started getting scared of driving in heavy traffic. If she was driving in heavy traffic, she felt as if she would die. As a result, she completely stopped driving the car. After a period of time, she even stopped stepping out of the house. Frequently she started getting crying spells. She was diagnosed as suffering from anxiety disorder. The word anxiety is derived from Latin word anxietas, which means uneasy or trouble-minded. Definition: when a person feels nervous or worried without any obvious reason for a long time, such that it starts interfering with the daily life, it is called anxiety disorder. There are many sub-varieties of anxiety disorders, but we will study two major anxiety disorders, namely generalized anxiety disorder and phobia. A. Generalized anxiety disorder. We all feel tensed in our daily life due to various reasons, for example, during exams, while speaking in public, etc. It is sometimes beneficial to experience mild tension while shouldering responsibilities or while facing a difficult situations. It compels us to face difficulty in a systematic and planned manner. But instead of mild or moderate tension, if it becomes too intense, it starts interfering with our daily routine as well as our work performance. We start feeling tensed or nervous without any reason. We start avoiding people and are unable to perform daily routines. To diagnose any individual suffering from this disorder, the symptoms should be present for at least 4 weeks for children and for 6 months for adults. Due to extreme nervousness, his capacity to solve problems may break down. Of course, as we have already seen, there is just one criteria to be fulfilled for diagnosis of any disorder. so consultation of the expert is essential. Symptoms: extreme fear of the unknown, increased heartbeats, irritability, frequent headaches, frequent worry, lack of sleep, sensation of vomiting, uneasiness and breathlessness, blackouts, etc. B. Phobic disorders. Ninad went for his college picnic. From the top of a hill, when he looked down, he felt an unexplained fear. Few days later, when he went to his uncle's house and looked down from 15th floor, he experienced the same fear. Thereafter, he noticed the same fear whenever he looked down from certain height. He realized that his fear is not normal. These are symptoms of acrophobia. The word phobia is derived from Phobos, the name of a Greek god of fear. We all are afraid of something or the other, and we normally are able to overcome it with little efforts. But even when something or some situations are either less dangerous or not dangerous at all, if an individual is intensely afraid of it, and that creates problems in adjustments in daily life, then that fear is called phobia. For example, heights, water, darkness, dog, cockroach, being alone, blood, crowd, elevator, etc. The individual then tries to avoid it at any cost. If it starts interfering with his/her daily life and creates adjustment problems for more than 6 months, then it is called phobia. In short, phobia is an intense and irrational fear of some objects or situations. There are various subtypes of phobias like specific phobia, social phobia, agoraphobia, etc.